Right now, in Georgia classrooms and schools across the state, a quiet emergency is playing out in the hallways. Look at an average student body. 1 in 5 has a diagnosable mental health condition, yet fewer than half receive treatment. Reorganizing this into a mortality risk graph for ages 10 to 24 reveals a stark reality. Suicide is their second leading cause of death. This untreated clinical load spills directly onto educators. Teachers are leaving the profession at historic highs, driven by the daily reality of managing acute student behavioral crises without medical support. Asking schools to handle severe psychological needs without proper clinical support breaks the educational environment for everyone involved. Georgia's legislative response is House Bill 268. A timeline shows a strict mandate. By July 2026, every school must have a comprehensive behavioral health program. Expanding the timeline reveals $20 million in state funding available before the deadline. But there is a massive chasm between school administration and legally compliant clinical infrastructure. This is the implementation gap. School administrators are educators, not clinic builders. Constructing this requires navigating complex hiring, managing strict HIPAA and FERPA compliance, and engineering secure teletherapy pipelines. Funding and motivation exist, but school districts remain stalled by the absence of a turnkey, ready-to-deploy clinical system. MentalSpace School exists specifically to bridge that gap. It operates as a direct, turnkey mental health partner ready for immediate deployment. Licensed professionals integrate directly into the campus workflow, replacing automated app prompts and anonymous hotlines with immediate human intervention. Schools receive a dedicated, culturally competent team of therapists. Because these clinicians are assigned permanently, they get to know students by name and build actual relationships, removing the friction of a rotating cast of strangers. This approach takes a rigorous state compliance mandate and turns it into an authentic, embedded extension of the school community. This diagram maps the MentalSpace ecosystem. The student node illuminates, providing same-day teletherapy and immediate crisis intervention. The system connects to the educator's node, offering staff wellness to combat burnout. Finally, the families node completes the loop, integrating family counseling. Financial logistics are handled directly. Care is accessible regardless of background, with MentalSpace accepting all major private insurances and offering a $0 out-of-pocket cost for Medicaid. The platform natively manages all strict HIPAA and FERPA compliance standards, ensuring privacy remains locked down with zero extra burden on the school. By addressing students, staff, and families simultaneously, this comprehensive coverage stabilizes the entire school ecosystem, rather than treating isolated symptoms. Deploying this infrastructure yields concrete, measurable results within the school. This bar chart tracks the core student metrics post-deployment, an 89% improvement in attendance, alongside a 92% reduction in reported anxiety. As this third data point appears, you can see an 85% family satisfaction rate across the community. This partnership fulfills the legislative requirement while restoring the school's primary function, letting teachers focus on teaching and giving students a dedicated clinical champion. Georgia's July 2026 mandate for House Bill 268 is approaching fast. The $20 million in allocated state funding is waiting, and MentalSpace is a complete clinical infrastructure ready to deploy immediately. Does your school district have MentalSpace yet? Don't wait for the deadline. Schedule your free consultation today to secure your mental health partner